Alexa, stop. Why is this working?
Hello.
Hello. Oh, you look all comfy. I like.
I got caught in the rain coming home. I didn't have an umbrella, and I got totally, like, literally soaked
Drenched.
to the bone. Like, all my clothes. I got home, I was dripping. Like, my mascara was like all over my face. I looked like I'd been in some kind of weird like water fight.
Yeah. That's so crazy but cool.
I've been really cold like since then.
I fucking love hoodies, and I love my you know those jackets that have the sleeve? You know what I mean?
Yeah, mine doesn't have that, but like the running, like, yeah, those.
I'm all about a hoodie. Give me a hoodie and I'm happy. Today, no fucking hoodie because it's like 90 degrees and 80% humidity. I'm dying. Yeah,
that sucks. But no,
my face feels
actually,
like it's melting.
It's like you might hear the train because the window's open, but it's quite humid here. But I've been like, I had to blow dry my hair because that's how like my hair was. Yeah. So anyone in New England, you know what I'm talking about because we've had some major rain today.
I wouldn't mind that because it would hopefully break this nonsense. But yeah, it's been fucking gross. It's been gross. It feels like New England weather.
Hey,
it does.
What's wrong with New England weather?
Oh hell yeah! New England weather is always hot, humid, and disgusting.
Yeah, it's really humid and yes.
I hated the East Coast. I hated the East Coast for that reason. It was just always so gross.
Yeah, it's gross. Oh, it means like the weather has been awful, say up north. Yeah, I think it's been through the whole country, but I didn't think it was gonna rain. I made such a schoolgirl error by not bringing an umbrella. But to be honest, an umbrella would not have helped me.
No, when it's pouring like that, it's not gonna do.
Nothing.
Do you guys have the brand Totes umbrellas?
I don't know.
TOTES? No?
No, I have no idea. I only own one umbrella.
Well, those were the umbrellas that you would buy on the East Coast because those things don't do the whole inverted umbrella thing.
Oh, I probably need one of those.
Yeah, and you can pop it up and it'll open, and then you can pop it again and it'll close.
All right, so
all you have to do is just Totes. Yeah, exactly. Emily knows what I'm talking about. Only fucking umbrella to ever buy. Everything else is crap.
I need to buy one. So
and they're like this. They're like, let me see. Here's my toothbrush. So this is my toothbrush. So it's like that.
Yeah.
And it's the smallest little thing that you can carry. I stick it like right on the side of my door, and then just open, pop, whoosh, huge ass umbrella, sturdy as fuck, and then boom, pop, breaks down, and then you just tuck it in. I love it.
I have to get one of those then, because clearly I'm like umbrella challenged. But today nothing would have helped me in today's world.
They were a brand of socks.
They are a brand of socks, aren't they?
Actually, they are a brand of socks. They're the no slip, right?
I have no idea.
I think they're the no slip sock.
I don't know. You can buy them in John Lewis. I buy everything in John Lewis. Okay. John Lewis is like the equivalent of like Macy's, but better.
Okay. Oh yeah. See, that was like what Lord and Taylor on the East Coast. Well, you had Lord and Taylor and Macy's. They were the same thing.
Yeah, it's like kind of Lord and Taylor, but like with better customer service. Because
Here they don't know. In California, they don't know what Lord and Taylor is. They're like, what's that? I'm like, it's like Macy's.
Lord and Taylor is such a great store. It's like Macy's,
better.
Yeah.
So much better.
Yeah, so much better. But yeah, anyway, so how have you been? Sorry about last week. I'm sorry about last week.
No, don't apologize. I totally get it. And like, hopefully.
Yeah.
Oh, I'm sure. I'm absolutely sure. And it's funny because last week, this had not started yet, but you can feel it in the bones. Do you know what I mean? Especially now that I find out that I have arthritis in every part of my back that got hit by the car accident.
Oh.
So it's like you can feel it now, which totally fucking sucks. And I was gonna cut my hair, and I'm just like, no.
Oh, that sucks. Okay.
Okay. But no, it's been good. It's been good. It's just like, and then.
Yeah.
I have a thing for Baby Yoda. Baby Yoda is so fucking cute, right? Luis came home with a Baby Yoda for me. I'll show you. Hold on.
Does anyone else know what a Baby Yoda is?
You have to be a sci-fi fan. Like last night, I just finished watching Witcher again. I'm such a dork.
Hi, Zara. Oh.
He's so cute. and he's squishy. But this is like really hard, and this is really hard, so you can't actually like snuggle up to him because he'll kill you. But he's so fucking adorable. He's Yoda, but he's a baby.
Oh, okay. Yoda as in like Star Trek Yoda?
Yes, yes. They have like a new series called The Mandalorian, but I'm just not willing to pay. Oh shit! I'm just not willing.
Do you see my confusion? Guys, I've never watched Is it Star Wars or Star Trek? Like, which one are we talking
Star
about?
Trek. No, Star Wars. Star Wars. Star Wars. Sorry, Star Wars. Whoa, I'm both. I like Star Trek and Star Wars, so yeah.
Star Wars.
I'm a total
Star
sci-fi
Wars,
nerd.
you Dumbo. I'm the Dumbo who doesn't know anything. Star Wars. I meant Star Wars, not Star Trek.
Star Wars, yeah,
Star
Star
Trek is
Wars.
with Spock, and the only reason I know that
Yeah,
is
Spock.
like Botox.
I always thought Spot was like, he was just so sexy. I don't know what people saw in like Chris Pine's character. It's like Captain Kirk was just Spock's where it's at.
I recognize Captain Kirk as the good-looking one.
You know, and it's funny because he might be physically attractive, but Spock is physically attractive and mentally attractive. Earthquake!
Sorry, I'm sitting on my chair, so I don't have my little stand. Sorry. So yes, Spock.
Oh!
Sorry. That's why the phone is moving.
Chris knows.
I'm not
Chris
on my
knows.
computer because I do not want to look at my computer anymore today because I'm done looking at my emails. I've responded to everyone's email today already.
Yay!
If you send me an email now, I am not responding today, I swear. This is not.
You have to cut it off. You really do.
Yeah, I'm not, but I have this obsession with answering emails like immediately, and it sometimes gets me in trouble because then I don't like think before I answer. Yeah, so if you've ever gotten a dodgy email from me and then I respond an email 10 minutes later saying, I'm so sorry I said that. I didn't check my notes about you. I'm so sorry. And you guys who are watching this, you know what I mean. Because I'm like, oh gosh, no, that wasn't your dose. I'm not an idiot. I'm just trying to
have surgery.
Yeah, I'm just trying to be efficient and do 10 things at once. Oh, anyway.
Oh, that's funny. No, you know, it's funny because I get it. I'm trying to do the same thing, and everyone knows in Twitterverse, in Instagram that I've been cutting back because you can be here forever.
Yeah.
Online, you can be online forever.
Yeah. Well, I sit on my email all day, so anyone who's ever sent me an email, you know what I'm talking about. I'm the kind of weirdo that you think that I literally just wait for emails to ping. Oh, do I sound quieter? I think that's because you know why? It's because I'm sitting in my. Let me move because I'm sitting in the wrong room. Let me move.
Well, is it really that she's talking quieter, or is it that I'm talking too loud?
No, I think that I'm talking quieter. But let me close the.
Because I was listening to the videos and I'm like, holy fuck, I am loud.
No, like okay, I've moved, and this is Emma. Is it better? I think it's Emma, but it's also darker. Yeah. Anyway, now things not shaking, right? Yeah. So anyway, so anyone who thinks that I have no life and I just respond to emails in like 3 seconds, I actually do.
It's a habit.
It's a habit, and I just
it's a bad habit.
Things in my inbox. It drives me mental to have things in my inbox and the things that are unanswered. So that's why I do other things too besides answer email. I swear to God. Oh, that's better. Thank you, Emma. Right. So we're here to talk about, because before we just, I can waffle on like this for like hours. So we're here to talk. We're doing our last session about, wait, what are we talking about? Are we doing Botox and filler still? Or are we talking about Isotretinoin and we're gonna do
Botox and filler, and we're gonna answer the question. So if anybody has questions, please post them in the latest Botox and fillers post, and we will answer them. Because I got to start off from yeah, I know, right? I wish I have pretty high eyebrows.
No, so let's talk about eyebrow placements because I think that's quite interesting because I think I did a video when I was in Dubai with Caroline's daughter, Mimi. I don't think it's been posted yet because it was like a video for Kings about Botox in younger people. And one thing she asked me in the session was, Caroline's daughter, Mimi, she asked me, can you give me like an eyebrow lift? Or she wanted some kind of an eye lift. And I was like, you know what? And I think I don't know if I said this or not. I have never achieved a natural looking eyebrow lift in anyone with Botox. And I don't understand how that happens. And I looked into it because I was like, am I just like stupid and just don't know? Because when I think of the musculature, I'm like, how would you achieve? I don't understand. And actually, if you look at the literature about Botox and brow lifts and things like that, it's actually a youthful brow is not an arched brow. So if you think about so just let's think about that for a second. So before you go and ask your Botox practitioner to give you a brow lift, And sorry, I shouldn't be reading. But so if you go and you ask about brow lift, just think about what a youthful eyebrow is. So if you look at younger people, they tend to have more straight brows and not a peaked brow like this, right? Yeah. And also, you can't lift an eyebrow permanently using Botox because the only thing you could do is relax the middle of the brow, and then the lateral wings of the frontalis muscle would overpower it and then give you a sprock brow. The only other thing you can do, because this part of your orbicularis muscle, the muscle around the eye, it pulls down on the eyebrow laterally, but it's a round muscle. So some people inject Botox right here to try to relax this muscle so it doesn't work as a depressor. But the thing is, this is a round muscle. So you will almost certainly diffuse your Botox and the whole thing will become kind of weakened. So that's like the opposite. So, because if you think about what you're doing, if you squeeze your eyes shut, yeah, that makes sense. Then that's a depressor, and that's bringing your lid down. So the idea that you relax that, now you wouldn't be able to like scrunch your eyes closed. Would that therefore make this muscle overpower and give you a little lift? Again, I've never achieved that with Botox. I don't really think anyone has. And I think the whole concept that you can give yourself an eyebrow lift with Botox is actually, I don't know where that's come from, but I don't think that's a real idea.
Well, and didn't you also say, though, that this is kind of like the danger zone when it comes to blindness?
No, that's with filler.
This is filler, not with Botox, with filler.
Yeah, Botox. So, and this whole, what we're taught in like Botox school, and I never went to Botox school because I did a master's in aesthetic medicine, so we did it as part of my master's. I never went to like a 2-day Botox or 1-day Botox training course. So, but I do know that in those courses, they teach you not to inject in this part of the face, so the mid-pupillary line laterally to about mid-forehead, because you can then cause an eyebrow droop. But again, I don't think that's true, because if you don't inject this muscle, what will happen is every time you move your forehead up, the only thing you'll see happening is a wrinkle here. And that looks like, that's a telltale sign of I've had Botox. And I've, yeah, I'm running out of
Oh, you froze.
Plug in my phone.
Oh shit.
I made
Okay.
that mistake. I made that mistake in the past with people's Botox, like when I was just starting out, that I would follow that rule about don't inject in the little box, and then they would have this funny slight lift here, which was like nothing would move, but they would create these little lines here, and I've had that done to me, and I was always like, I don't like the way that looks, you know, it's weird. So a couple things, like I would say, if you're going to go to your Botox person, don't ask for a brow lift, because that's going to give you a Spock brow. I'm plugging in my phone, so if something happens, just, yeah, there you go.
Don't you hate that? You're so afraid you're going to like knock everything out of the park if you just plug it in.
Turn something off. I hope it's charging.
Oh, it just got brighter. Oh, wait, you froze. Hold on. There we go.
Because it plugged it in, you see. So, because I plugged it into my computer. So that's the computer light.
Nice.
Yeah, nice. So yeah, basically, so don't inject here. I love this iPad. I've never used this on my iPad, but it's quite a good pointer for this. Yeah, so I wouldn't inject Botox here. I would do Botox all across the forehead. And the other thing that I think about a lot is a lot of patients come and they say, I had Botox before and it's given me brow heaviness. Have you ever had Botox, Kat? No.
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 Never. Anywhere. See?
Do you have wrinkles? Can you relax your forehead? Like move your hair out of your way and let's just relax your forehead. So you don't have any static lines, do you? No.
I have very, very faint static lines. Like you can really see they're just really microscopic. I mean, they're so faint. They're nothing like this. Like this you can actually see.
Oh, that's different though. So we can't do anything. That's like skin laxity. So basically,
there they are.
You don't have, but you do have like a slight, do you ever, I mean, you maybe have a slight eye, like your upper lid is a little bit like,
this is definitely droopy.
A little bit droopy. So does your mom have a droopy upper lid?
Yes, but she also has type 2 diabetes. So doesn't that change your face also?
Yeah, it kind of affects the collagen and stuff. Does she have a lot of wrinkles on her forehead?
No, she's like me. My dad too.
Oh, she's fine.
We're actually thinking about it. We're all lucky that way.
Okay.
I think like they might have the 11s. What I call the 11s.
Yeah.
I don't even have that. I have to. You know what I mean?
Yeah.
So yeah, you don't ever really see it.
So
Now I have
with
to find one.
so with Botox, like you get people come and say, I had Botox before, and so one of the first things I ask is, okay, well, how did you like it before? Because that really does help, me understand kind of where we're going with Botox. And they're like, oh, I liked it, but it made my forehead feel heavy. And so I'm like, okay, well, it gives you heaviness, and that's almost certainly because that person has a droopy upper lid. So if you have a droopy lid over time, what happens is that you develop hypertonicity, or like overuse of your forehead muscle. So your brain says, I need to lift my
Is
eyebrows.
that why Luis says that my eyebrows go above my?
Yeah.
He's like, your eyebrows come up to here.
Yeah, so that's probably because your brain is like, let me lift my lid, because if I don't do that, then I'll have a droopy lid and it obstructs your vision. So as you get older and people develop, and some people are quite young and develop a droopy upper lid. So that's genetic. That's just part of who you are. Not you, but like a younger person.
No, I'm trying to remember, because like this is like ridiculous now.
So I have patients in their 30s who have very droopy eyelids. And then they come in and they say, can you get rid of my forehead lines? But the last time I had Botox, it made my brow heavy. And I'm like, okay, well, there's a couple problems here. The reason that people develop static forehead lines, so lines on the forehead you can see all the time, is because they have droopy eyelids.
How come I don't have them then?
Well, I think you have a little bit.
Well, no, I mean, I have severe droopy eyelids. I don't have like anything here worth
you have
noting.
some, but I think perhaps your eyelids aren't droopy enough, because I've seen people who properly I see a lot of elderly people. Like I would say that I have 15 patients today. I had like 10 over the age of 80. Okay, so today
Wow.
in the clinic, yes, I see lots of like 80, 90-year-old patients, and I always examine their faces, because obviously I'm doing facial surgery to them anyway. So then I look at their faces and I really pay attention to the wrinkling. And what I see a lot I should take some pictures of them, because they love having their picture taken. They're such love. They're all such like love. Older people are just like, yeah,
They're so adorable.
Darling. It's so cute. They're so cute. So the thing is, what a lot of them have is they have the droopy lid, and then in response to that, over 20, we're talking an 85-year-old, they develop an arched brow from chronically having to raise their brows, and then the muscle overacts. So if you guys look at some older people, like look at your grandparents, we're talking about people like over 80, and you'll see that they have arched brows, they have droopy lids, and they also have lots of wrinkles. So
yeah.
So forehead wrinkles, to me, if you have permanent forehead wrinkles, they're almost certainly partially due to having a droopy lid. So the way to correct the forehead wrinkles is to correct the droopy lid, because then you won't have that hypertonicity of your frontalis muscle.
So here's a question then, because you're saying, and I try not to put this in the direction of me, but now I'm really curious. So I've got the droopy eye, I have the arched brow, which I've always had, which is probably how I got into bars all the time, because you're saying that it makes you look older. I got into bars at like the age of 18. Well, no, 16, 17. No, 17.
Right.
And actually, no, it was 18, because the age was 21. So yes, it was 18. Sorry. So I have a very droopy brow now. Yeah. Very droopy. I have very, very faint lines. When I went to a dermatologist, he's actually like, no, you don't need Botox. If anything, he does. And he's 12 years younger than me.
Right.
But he's got like the deep ass 11s, because he's the, the broody man. Always, But yeah. But he doesn't have, he's got fucking gorgeous eyes too. He doesn't have a droopy lid. So that's why I'm like confused with, I have very faint static lines. I have very, very faint 11s, and yet I have severe droopy eyes with an arched brow.
Yeah, I don't, obviously this isn't a hard and fast rule, and so I'm just hypothesizing. Yeah, so because I just think about what I see and who I see. One thing you don't have wrinkles, but what you do have is and this sounds weird, but you are able to create a large gap between your eye and your eyebrow. Like you can raise your eyebrow super high.
Which always cracks Luis up. He's like, how the hell do you do that? I'm like,
yeah, so that may be why you don't have a lot of eyebrow wrinkle. And I know this sounds stupid, but because you are, I don't know, you're able to do that. I don't know anything about that. That doesn't make a huge amount of sense.
No, but and it's funny because growing up, we used to always try to do now I can't do it, the one eyebrow up. We'd do the whole little, so we would do that, which now, of course, I can't do. But he laughs every time I'm expressive, which is why I never want to get rid of it, because I think it's fun. Yeah. In other words, I don't want to do Botox because I love the fact that people respond to my, I guess, hyperactive eyebrows.
Yeah. So I mean, I think I do think there's a lot of connections though. So and I think that's why when you put too much Botox into someone's forehead when they have a droopy lid, they feel heaviness because they're used to always raising their brow. So you have to be very careful.
Good
Yeah.
point.
Yeah. So if you can't do that, then you'll feel like it's really
Hydroquinone.
heavy. So I go really like micro dose when I dose people when I think when they have droopy lids. I'm like, oh crap, and then you have to, there's a trade-off between getting rid of the wrinkles and giving you the heaviness. So some patients, they want they're just like, I don't want the wrinkles, just like, I don't care about the heaviness. And then I have some patients who just hate that heavy feeling. And they're like, what do I do? And I'm like, well, get an eyelid lift, or we do micro doses of Botox, and then you just have to have the wrinkles. So anyway,
So for anyone
yeah.
out there who has what I have, because of course we're getting older, I'm getting older, you're not yet. What does somebody do for this? That would have to be an eye lift, right?
You would need something called a blepharoplasty. Yeah, so you need the excess skin removed. So an upper lid blepharoplasty. Some derm surgeons, I don't do them, but some derm surgeons do. I do a lot of surgery to the lid, but I myself don't do cosmetic work to the upper eyelid, and that's partially because, and this sounds really horrible, but it's a very highly litigated area of derm surgery. So blepharoplasties are one of the top causes of like being sued, apparently. So for me to have medical negligence insurance for blepharoplasty, it cost me like £25,000 for 12 patients a year or something. So
It makes sense. Stay away from it. Yeah.
Yeah, I'm going to leave the eyelid lifts to the doctors who specialize in ophthalmology. So those are oculoplastic surgeons. So they're ophthalmologists who do plastic surgery. And so if I was going to get an eyelid lift, I would go to an oculoplastic surgeon.
Oh, this is good to know. So for everyone watching, don't go to a cosmetic surgeon or a plastics. Well, even a plastic
you
surgeon.
could. So now I'm not a plastic surgeon, right? Okay, but I spent a lot of time with these oculoplastic people and plastic surgeons, like hanging out, like in between patients and stuff. Hello. So,
Let's chat.
like, who are you? Like, okay, thanks, guys. But anyway, so what I do know is that because I could like to pick their brains, you know what I mean? I like to ask them all these questions.
Yeah.
And they're like, wait, who are you? Are you the registrar? I'm like, no, I'm one of the consultants. They're like, oh. So I walk around looking like this. So they're like, anyway. So these really fancy schmancy oculoplastic surgeons, doing an upper lid is actually quite straightforward in the grand scheme of facial surgery. It's not easy, but it's relatively straightforward because you basically just lift up the skin, you chop it out, and you stitch it back together. Even I know how to do that, and I'm not a plastic surgeon, okay? Lower lid, whole new ball game, okay? Because this is a functional area. So if you screw that up, you
can have droopy lid.
Yeah, you're not going to be able to use your lower lid. And also, let me use my little pointer here. Unless you do it internally, where you take care of the fat bag, you have to create a scar right along the lash line, and you need someone who really knows their crap because there's multiple layers of tissue here. Yeah, oops, sorry. There's skin, there's muscle, then there's the I can't remember do you know, guys, I've had a long day. The name of the thing that moves the eyelid. It will come to me in like in a half hour.
Oh, yeah.
Yeah, I can't remember. Anyway, that thing, that structure. So like when I remove skin cancers from the lower lid, if I have to do a full thickness excision of the skin cancer, I will not repair that because I will send it to an oculoplastic surgeon who will do a multi-layer repair so the function of the eyelid is preserved. Because I don't know how to do a multi-layer. I'm not an oculoplastic surgeon. It sounds like it's a very small difference, but actually it's a massive difference because you have to stitch it correctly so that the stitches don't rub the eye. So there's a very it's like a way they do it.
Crazy.
Yeah.
Well, no, and I kind of know a little bit about that just because I have a ton of skin tags, and I had one right here.
Yeah.
And two different doctors wanted to do two different things, and I'm glad I went with the second one because the first one wanted and the first one wanted to go in and just like, well, we're gonna do this and we're gonna do that, and you might end up with a droop, and then you'll have to come back and I'll have to fix it. I'm like, no, bitch, you're not fucking doing that.
No,
so I went to the other one. He's like, no, I just have to cut it off.
Yeah, so I just shaved them off. Yeah, I did one Wednesday. Wait, which was Monday or Tuesday even. So yeah, you just gotta even know what date it is. But you just whack it off. So it's Wednesday. So yeah. So so the lower lid, I would definitely see a specialist surgeon for that. Upper lid, Yeah, a plastic surgeon can probably do it. A good head and neck plastic surgeon can do it. So there's a couple of them I'm friends with in Dubai who I would trust to do my upper lid if I ever wanted it. But anyway, so yeah, lids. I
So,
like
but if you want to do both, because of course I have the double whammy, so I
then
want to
you
do both.
go to a
You want to go to
specialist,
an ocular, whatever. Okay, so I'm
oculoplastic,
gonna go to one of them.
or an
Fuck that shit.
ophthalmologist that's a surgeon. Yeah, because then they do it with you awake and stuff, and then like they go in, snip it, you know. But I do think I do like a bit of eyelid surgery. Like it's something that I would definitely have myself because I think it's very it helps. You know, it's a real subtle thing to improve appearance, and I've seen some really beautiful results from it. So anyway,
Yeah, I definitely, yeah. Anyway, I definitely want it done because, like you're saying, you know, but mainly like this just makes me sick. I don't like that at all. And now that I know what you're saying, I'm not going to go to Dr. Gavami for this because, as as a perfectionist as he is, I would rather go to somebody that does it all the time. So I'm
the
glad that you're
lower
saying
lid
it.
definitely, yeah. So
Yeah.
that's with your little herniated pad there. That's the way to go. Right. Okay. Sorry.
So, do we want to answer some questions?
Sure.
Okay. I can't remember where we left off, so this is going to be fun. Can Botox make the, oh yeah, we already answered that, make the nostrils smaller. Treatment sagging jowls. I think you mentioned the sagging jowls last week, or the week before. Results if you have Botox filler. Oh yeah, and then I think you answered this one too for Carolina, which gives a better result if you have lines above the lips, filler or
Both.
Botox, and I think you said filler.
Or
Yeah.
both. Yeah, a little bit of both, but filler. Yeah.
So for somebody like me, I don't know if you can
You
see
don't
it, it would
really
probably
have
be
that.
filler.
I can't really see it, but yeah, both.
No,
A
yeah.
little bit both, but yeah, filler.
Oh, and then we answered the Dysport thing, the Botox Dysport.
Yeah, just both.
Number. Oh yeah, and then this. What if you stopped right away? Would it sag? Does Botox cause Okay, you already answered that one too. Okay, and then the stretching. There was one in here. Oh, and then Emma's with gently lifting the brow. Does Botox texture on the forehead? Jesus, we almost answered all of these. Tear filler. You
Yeah.
answered Lucy Dawson's when. Oh, I think this is what you were basically just talking about with Caroline. Why, when you have Botox in your forehead, do you get a droopy eye? Had it done twice, and it happened both times, so won't have it done again.
Yeah, that's a technique problem, probably.
I would think so, because I know that, like, especially out here with Groupons, people tend to go, yeah,
Groupons or
yeah.
Botox? Yeah.
Yeah, you got to be careful with that shit. You got to go with somebody that just knows their stuff, and if you got to pay more, you got to pay more.
But you know what? And also,
Um,
it's interesting just on that point. Like I used to say a lot, and I've stopped saying this recently, but that Botox is very easy to do and it's hard to mess up. But actually, that's not true. So
I think Botox is difficult to do. I think it's
yeah,
easy when you have the training.
yeah,
I don't think it's easy. Because, I mean, perfect example, and I hate to bring this up, but you were doing it to yourself, and you're like, oh,
yeah.
shit, I fucked up.
I did it to myself,
And
and
you're a professional.
I needed someone else to feel my musculature and kind of put it in the right place. So, oh my God, I still can't believe I couldn't move my mouth properly. It's better now. It's all back to normal. It went away really quickly, which is good. But I think it's partially because I didn't use a lot. I put about 1 unit in the wrong muscle. But also, the more you use the muscle, the more likely it is to just go back to normal.
To just go
So,
away.
but
Yeah.
it was like or 2 weeks of like I can't smile, and it really made me think, oh, what the hell have I done? But I think with Botox, it is easy to mess up, and then the problem is you can't fix it. You just have to wait until it goes away.
That's right. You can only fix filler. You can't
Yeah,
fix.
there's no like
Oh,
antidote to
fuck.
Botox. Yeah, so that's why I was like, okay, I'm just gonna talk like that. I felt like I didn't smile properly. It was really
Yeah.
weird, and I will never do that. It's good I did to myself before I ever did it to anyone else. But I've done it fine to other people. It's hard to do it to yourself. But I do think that Botox is a lot harder than I ever really appreciated, and I think it's because in the world of medical aesthetics, so many people do Botox. And so you think, oh, it must be really simple if loads of people can do it. But actually, I see now that loads of people do it badly. Not badly, but maybe not.
Carelessly.
Yeah, and like not really, like the way we're taught to do it is probably not entirely accurate. But just like so many things in like education or whatever, it gets the same thing. No one changes anything. So like you realize that it's not correct, and then everyone learns it incorrectly anyway. I don't know. That happens in a lot of areas.
Well, it's science. You're always learning. So,
Yeah.
yeah. And I mean, perfect example. And like with everyone posting what they're saying, you know, why is there so many, you know, negative effects and whatever to Botox and fillers? Well, that's because people don't necessarily know what the fuck they're doing. Or at
Yes.
least not the way that they should, because you shouldn't be paralyzing people and making, you know what I mean? You shouldn't
Yeah.
be.
Yeah.
I mean, if you're doing it to yourself, that's one thing, because you're doing it to yourself, and yes, it's different. That's like trying to cut my own hair versus trying to cut somebody else's hair.
You shouldn't
Easier.
cut your own hair. It's a mistake.
Yeah, well, I unfortunately have to with this whole COVID shit.
Yeah, and don't do your own Botox. I mean, I would never do my own filler, though. I once did a filler to my own scar, which
Did it work?
It worked, yeah, but it was hard to do, and it was like trying to angle it. Yeah, I don't recommend that. But this is one way that we kind of learn, because like I can't sue myself. Do you know what I mean?
That's true. Yeah, you're your own human guinea pig. So
yeah.
Yeah.
So you know what do you do? But yeah, so I think Botox is a lot harder than we kind of give it credit for. And you know, going to see someone who has a good understanding of facial anatomy, like there's a really great ENT surgeon who does aesthetics at King's, where I work in Dubai. Dr. Peter, he, you know, understands facial anatomy, because he does, you know, nasal surgery. If you do any kind of surgery in the head and neck, you know, in like eyes, nose, whatever, then you understand the anatomy well, and then Botox will be easy. But if you're like not a trained facial surgeon, then it's perhaps going to be slightly more, you know, challenging.
Well, yeah, because you don't know it like the back of your hand. That's not like what you, yeah. I mean, that makes perfect sense. Kind of like what you were, well, we won't go there. Never mind. Robin C. Art. I have heard the textured orange peel skin on chin. Oh, this.
Oh,
that
yeah.
right there.
Yeah.
On chin that comes with age can be treated with Botox. Is this true? Will Tret help also? Tret won't help, see?
That's a muscle, yeah, but that's a muscle that you can inject and stop yourself from making that's called a cobblestone chin. Oh gosh, what have I? It's my guys. My hair got a mess today because of the rain, so just ignore this.
No, it looks good.
So it's good. It's called a cobblestone chin, and that's where I did the Botox wrong. Yeah, so if you that's your mentalis muscle. So if you inject like one spot into that cobblestone chin, you won't be able to make that expression anymore. So then, you know, that would take away that what someone's calling an orange peel look to the chin.
Peel. Yeah, I like that. So Robin C. Art, you would want to have Botox injected in there.
Yeah, just a little, like 2 units. That's it. Like not a lot. Like it's less is more.
And does it also feel heavy, like the forehead, or no?
No, it shouldn't do, unless you put it in the wrong place, which is what I did.
Oh, which is why you ended up with. Okay, got it.
Yeah. So, but if someone is feeling your chin, they'll know. Like, I just put it in the wrong place.
Which, I mean, come on. Again, you're doing it to yourself. So my brother, Carl, wants to know, aside from the most common cosmetic uses of Botox, what are cutting edge or exciting ways Botox is ever used? I've read it can be used for overactive bladders, excessive sweating, which we already spoke about the excessive sweating. Are there other exciting ways Botox is being used to help people?
Yeah, so with the treatment of migraine?
Yeah, that one's common. Yeah. But like, for example, I ended up, and I don't know if this is a good idea. I'm actually glad that we're talking about this. So I called my orthopedics office because they told me all my mess. And I called back and I'm like, can I do Botox? Can I do Botox here? And can I do Botox in my low back to mitigate my pain? Instead of lidocaine, because I don't want to be numb. I want to know that I have pain, but I don't want to be in constant pain. And they haven't gotten back to me, but they said that it is possible. So is that true? Yeah.
I don't know, but if my dad's watching this, oh wait, we have comments turned off, don't we?
Oh wait, no, I'll turn it off. I'll turn it off, Dad, if you're watching. Hold on.
I don't know if my dad's watching this. So my dad is a neurologist, like a yay, a neurologist.
Yes.
He's a pain specialist, like within the world.
I love your dad already.
Yeah, I don't know if he's watching. You might not. What time is it over in Boston? It's like 3 in the afternoon. It's Wednesday. I think he might actually be working. So I don't know if he was watching, but I can ask him later. So he works at a. I think it's called Boston Pain. I don't actually know the name of the clinic, but anyway, good. I don't know. But he does a lot of Botox for pain, and they do clinical trials of all that stuff. So I can ask him whether it's for pain, isn't it? You want Botox
Yes.
to your spine for pain. Yeah, I
So
can
like
ask them.
yeah, ask like where in the body can you, if you can, and where in the body can you inject it for pain? And is it similar, actually, just have them watch this. Is it similar to, and it's at 11:30, so 30 minutes in, you can tell I'm 30 minutes in.
Yeah.
Um,
Okay.
is it good? In other words, is it numbing like lidocaine, which to me is dangerous because if you don't know your pain, you're going to cause more damage to your body? Or is it just relaxing where you do feel the pain, but you're not going to feel it so strongly?
No idea. But I will say
That's
this, that my dad, he can inject Botox into anything because he does lots of it for like headache and pain, but he is not good at injecting it for wrinkles. I'll tell you that. Dad,
Isn't
you
that funny
are
how that
not
works?
good at it for
That is so
facial
fucking funny.
wrinkle
I can take
injections.
away your pain, but I can't take away your
Yeah,
wrinkles.
you can deal with pain all you want, Dad, but when it comes to aesthetic use of Botox, you are not that good at it. I'm so sorry. We'll have a little tutorial next time I see you, which God knows when that will be, bloody coronavirus. So, but yeah, we'll have to do that. And it was my dad's birthday on Sunday, so
Oh, happy birthday,
happy birthday,
lady.
Dad. So, but yeah, anyway, I'll have to, no, seriously, like the way he injects Botox is just like, he's like, here you go, whack. I'm like, that's not how we do it. But okay, he's like, oh, what, 10 units there? I'm like, no, Dad, not just 10 units. Like, that's not how we do this. He's like, just here and here. That's it. No wrinkles. I'm like, oh my God. And he was like, and with the eye injection, he's like, just one here and one here. I'm like, no, Dad, not just one and one. Like, no wonder my mother's never let him do her Botox. Jeez. Anyway, yeah, don't let a neurologist do your anti-wrinkle injections. Gee, and he's
So
just like,
yeah,
oh,
because
it's fine.
yeah, because what I really and I know especially like my brother, can it be injected in the hips, the low back? Like mine is like L4 and L5, and then whatever this is right here, this right here is where my problem is,
That's your
which causes great. Yeah, so here and then in my L4 and L5.
Okay.
Does it help with arthritis?
I
Does
don't
it
know.
help? Well, no, these are all the questions that I would like
ask
love
Dad
for
and
him to be
ask
able to answer.
Yeah.
Yeah, so that would be freaking out. Like knees, can it be injected in knees?
No! Oh my God, Caroline had it injected into her knees. Remember? With the skin to like.
She never said if it worked.
It didn't work. I know.
Wait, it didn't do anything bad, did it?
No, but it injected into the muscle. It didn't do anything. We knew it wasn't going to do anything. We knew it wasn't going to do anything. So I knew, and I was like, seriously.
And so
Anyway.
she did it, and it hurt, and it didn't work.
I don't know if it hurt that much. Caroline's quite a.
That hurt. That area hurt.
She's quite a strong. You know, she runs ultra marathons. Like she can take a little bit of Botox injection. She'll be fine.
Yeah.
I think she's probably.
I'm a chicken shit when it comes to needles. I can take any other pain, but needle pain.
Yeah, little needles. So, do you have any more questions?
And then you did say that it works for TMD.
Yes, it's very good for TMJ. Yeah.
Okay, good. So then, oh well, this you can't answer. From Montsevelle, how much should a Botox session cost? That varies, right?
That varies by practitioner, the type of Botox they use, country, and Botox is a brand name, so we should really say anti-wrinkle injection. So it depends on the type of anti-wrinkle injection, but it really depends. Yeah. So.
Okay, good. And then the same person, Montsevelle, what is the appropriate age to start getting Botox? I think you answered this last time, but why not hit it again?
When you start developing static lines, or when you kind of start to see the lines forming and it bothers you, everyone makes lines when they move their forehead. So unless you've had Botox like me, where I don't have lines because I can't move my forehead. But that's when, I say that's when you should start doing it. I started doing Botox to my face when I think I was 31. So.
But you were also saying that if you start too early, you can end up causing a little bit of atrophy, and then
and that again happened to me as well. So because I did a lot of messing around with and that was like almost 10 years ago that I did that. So guys, I'm 39, so I started doing Botox when I was I think I was 31 years old. But it was also part of kind of training, and I know it sounds stupid, but I was learning to inject things, and so it was part of the
so
process.
you're gonna inject yourself. Shit, if I'm learning that stuff, I'm gonna inject myself.
I didn't never injected myself until recently, and I was having like other people.
See, if I was learning anything like this, I would guinea pig myself to death. I'd be like, oh, let's just see what happens.
I have never taken blood from myself. I don't think I'll ever do that.
Oh no, that's different. That I won't do. Luis, however, he had no problem with that. He would actually let his students, because he was med tech, he would actually let them train on him. He would let them poke him.
No,
I'm like, dude, no, you're not stud. No, no.
no, blood taking is outside of my, no. I can't even watch it being done. I'm one of these people who's like, just do it, don't tell me.
I'm like, no, stop. And I love vampires. Get that one.
Oh, right.
Yeah.
Yes.
So this name I have a hard time with too. Fern Heledian?
Yeah.
How
Fern. Yeah, Fern.
Yeah, this is a good one. How effective is Botox for a hyperactive upper lip? My doctor says it lasts for a very short time because the mouth is very active. Yeah, I think you said that.
Yeah, and I don't know what you mean by hyperactive. Do you mean a gummy smile?
No.
You know what a gummy smile is?
No.
So a gummy smile is when you smile and you show too much of your upper
Oh,
lip.
that's me. That's me.
Yeah. Oh, okay. Well, if you didn't like that, you can inject Botox just 1 unit here and here to relax that muscle so you can't smile like that.
Really? Oh, that
Correct the
hurt
gummy
just having
smile.
you say that. Oh my God.
It's not that bad. There's a specific point that you have to do it. It's like measured. And then I don't remember what it's called because I can't remember anything right now in terms of names.
So it would actually be down here?
No,
Then
yeah, exactly. So you wouldn't be able to bring your upper lip beyond your, like, there.
Oh God, no, I kind of like the way that it,
Yeah,
oh no,
you have
it's
a
so
good
weird.
smile.
That'd be so weird. I really like my expressive face. I guess Botox is not for me.
No.
Well, maybe my chin, maybe here.
You have a cobblestone. Yeah.
Yeah, I think I want to get rid of that because that is kind of ugly. So Sierra Gould, can Botox help sleep lines? I can't sleep on my back and wake up with lines vertical on my nose. Oh, these little guys right here.
The bunny lines?
No, no, not bunny lines. They're vertical.
Oh,
So
no,
like
I don't think so. That's not a muscle problem.
Oh shit, mine are gone. Hey, Sierra, try tretinoin. Mine are gone.
Okay, so you have to remember that anti-wrinkle injections or neurotoxin, it relaxes muscle. So if your line isn't due to muscle, then it's not going to do anything.
If it's due to this,
That's not going to, no, that's not going to do
okay.
anything.
Because I used to have a really deep one right here because I sleep on my side.
Yeah.
And now it's not there. It's gone since I've been doing tret. Why?
Yay.
Yeah. Hell yay.
Cool.
So what can she do then? Filler?
No, nothing.
Nothing. It's just what it is.
Just,
And
yeah.
well, not only that, it's sleep lines. They're gonna go. They should go away during.
Kiara's asking, can it be filled? Not if it's temporary. Is it Kiara? Is that how you say your name?
Is it Kiara or Ciara?
Or Cia?
It's gotta be Kiara. It's Kiara. It's Kiara.
Yeah, sorry.
I'm just thinking back.
No,
you're right. I said
if you fill it and if it's temporary, then no. Filler adds volume, and so if you don't need it there all the time because the lines are temporary because they're only there when you wake up, absolutely not. Don't put filler in your face. Avoid at all costs. Okay.
Okay. Yeah. No joke. Right.
Generally.
So I think it's Astia 7. How often and for how long? Wait. How often and for how long period should we take a break from Botox not to have muscle atrophy?
It's not about taking a break. It's about the amount you use each time. At least that's in what I think. This isn't something that you'll ever read in a textbook because there's no like
Actual study.
Yeah, there's nothing to say that. But it's about volume used. So you know, I at least in my opinion, it's about volume used. So if you use a lot of Botox every time you get it, then that would probably lead you to have you know, muscle atrophy. But it's also
She's coming to see you.
Okay, but also yay. But also you know, you don't need to ever have a break from it. So like if you start to see that your forehead's moving after 4 to 6 months or whatever, I mean, I have some friends who can get Botox once every year and that's enough, or well, sorry, twice a year, and that's plenty. Then you should be fine. You shouldn't, but and also muscle atrophy is quite unusual. I mean, I know that I did it, it happened to me, but that's because I really overdid it with the, I had like, I just put too, I allowed too much to be put into my forehead, basically.
Yeah.
And it was partially experimental too, because like, you know, when you have friends, you have a little bit of Botox left over from their clinic and they're like, hey, you know, where do you
Let
want
me
it?
inject you!
It's like, okay. So
Let's play.
You know, and then it was like too much because I didn't need it. So, you know, you learn.
And then,
this was a long time ago. So. We do stupid
And
things
then
when we're
again from
young. Yeah, sorry.
Astia7, she was also the one that kept on pressing, wanting to know more about the blindness risk.
It's not super
Yeah.
high, but it's there. So it's
Oh, so
extremely
now is it from Botox or filler?
filler.
Filler. Okay. So here's the question. Sorry, I didn't get last time. Is blindness possible after Botox under the eye? After Botox under the eye?
No,
Or is blindness just a filler complication?
it's a filler complication, but it's very rare. But it is
Okay.
something that you will always be consented for before you have filler. So you'll always be they will always say to you, that is a risk around the
Okay.
eyes, around the glabella here, around the temple, and it's not to scare you. It's just because we have to tell you. Yeah.
You have to be real.
Yeah.
And then I think, did we get any questions today? One comment. Yippee. Let me see what this question is right here.
Yay.
How long does Botox last? How often does one need to redo it from PMNY CDXB?
Oh, Penny. Yeah. So it can last for usually 3 to 6 months. You redo it when you feel like you're ready to do it again. And yeah, that's basically it. Does that include the non-surgical nose job? Yes, but it does depend. The blindness thing. I mean, it does depend a bit on where you're having it injected. If you're doing it here, there's no blood vessel on the nasal bridge that connects to your orbital system because you have the one here, and that's it. So your angular artery. But then here you don't have any. So if you're having filler put in the nose on the bridge, then probably not, because there's no blood vessel here. There's no big vessel here on the nasal bridge.
People actually get injected there?
Yeah, to improve the
The ridge?
the bumpiness.
I like it.
Yeah, I mean, I have a very prominent bone here, which I may fill around it, but I don't know. That would just be for me out of interest to see what happens.
The only thing that I want to do is like slightly reduce this, but that's just because I'm getting older and I blow my nose all the time. From Zaza, best way to lift the nose tip, make the nose appear smaller.
Not through anything I can do.
So that would be more cosmetic, right?
Yeah, see a plastic surgeon. Yeah,
Okay.
nose guy, not me.
So now, would you like to, in the last almost 10 minutes that we have, would you like to discuss the what was it?
Hi.
Oh shit, I forgot.
What?
What, with the other one, the isotretinoin and
Hydroquinone.
hydroquinone.
Yeah, I'm getting so many questions.
Chris,
about
this is for
hydroquinone.
you.
Yeah, I don't know why I'm getting so many questions about hydroquinone right now. I don't know what the deal is, but yeah, because things go through waves. Someone must have said something or written something about hydroquinone to get people a little bit freaked out. So one of those
stupid forums.
Yeah, one of the questions I got was, do you need a break from hydroquinone after a certain amount of time? No, you don't. And I'm not sure where that concept has come from. I think it's come from the idea that the way that the NHS or that doctors prescribe something called Pigmenorm, which is a hydroquinone combination compounded cream that has retinoid in it, hydroquinone, and a steroid. And in the NHS, because it's like national health, they used to only allow us to prescribe one tube of it because it's like 400 pounds. It's really expensive. So, and one tube lasts for 12 weeks, supposedly. So then we'd only be allowed to prescribe one tube, which would last for 12 weeks. And so there was a limit to how much hydroquinone you could use. And I think, so part of the idea came from the 12-week thing. And I actually am looking at my Instagram content that's coming up. And that's actually, why don't you need a break after 3 months of using hydroquinone, is one of the questions that I was answering the other day. Because I prepare my Instagram content, obviously, so I don't write it on the day that it comes out, usually. So I was answering this comment, and I'm not sure, again, where that's come from, but the 12-week thing. But do you know what I mean? Like, 12 weeks is like everyone's favorite time period. Yeah, I mean, I agree that it's scaremongering around HQ. Like, the 12-week diet, the 12-week fitness, the 12-week, meditation program.
Yeah. And you remember how you told me to go ahead and find some here before I got on Dramatica to like look on Amazon and find it? Even on the packaging, it says that you should stop after 3 months.
See, I don't, again, I'm not sure why. I need to look at the FDA approval because it must be somewhere in the depths of the FDA approval. It may be because the studies used for the FDA approval were not for more than 3 months. So that might be something really like arbitrary, like the studies only went for 3 months, so we don't know the long-term consequence, and therefore we are only allowing you to use it for 3 months. Because a lot of other topicals, like for example, I think Soolantra, which is a topical we use for rosacea, is also for 12 weeks, but that's almost certainly because the trials used to get the licensing were only done at 12 weeks. Yeah.
Yeah, because you have your patients on like anywhere between 4 to 10% hydroquinone all the time, right?
Not all the time, but yeah. But
Oh, okay.
initially, yeah, it depends on the patient. But initially, yes, and then I wean it down in order to get down to maintenance. But I have patients who are on a 2% hydroquinone 3 times a week for years, and to maintain their clearance of their melasma or their pigmentation or whatever, and that's totally fine. There's nothing wrong with that. It's a very well tolerated cream. Like for example, and I always go to use the extreme example of vitiligo. Like we depigment vitiligo patients. Like think of Michael Jackson, who I loved, by the way, and I was devastated when he died. Yeah, so I'm a huge MJ fan. Now
My
he
dad
had,
too.
yeah, huge. Like I had such a
Yeah.
crush on him when I was younger. Yeah. Anyway, so Michael Jackson had vitiligo, and he depigmented himself. And the only way because he went from being quite a darker skinned, young boy to being properly like white pale, right? And
Yeah.
that wasn't
Yeah.
makeup. So
So that's because his skin was automatically bleaching?
no, he had vitiligo. So
Well, I don't even know what that is.
oh, sorry. So vitiligo is an autoimmune depigmentation disease. You know that model? Oh God, what's her name?
Oh, when you get the, yeah. I know what you're talking about because I actually had a friend who had that and I didn't know what it was.
Yeah, the model who has she has vitiligo. So she has the whiter patches kind of around her eyes, around her mouth, and her nose. And then she's actually she's Afro-Caribbean, so she's African American. I think she's American actually. I don't even know, but she's darker skin colored. So vitiligo is an autoimmune disease where your body attacks the pigment producing cells. Oh, Winnie, that's it. Thank you, Kiara. Your body attacks the pigment producing cells in the skin and destroys them. So then you develop like completely depigmented skin. So the melanocytes get destroyed, and so you don't have any melanin. So Michael Jackson apparently had vitiligo, and he almost certainly depigmented. Oh, she's Canadian. Thank you, Emmy. So he fully depigmented himself using almost certainly hydroquinone. And when I depigmented patients in the NHS, because we do that treatment for people, so I've depigmented a number of patients because they have severe vitiligo, and we use 20, 25, 30% hydroquinone cream. Yeah, and they apply it all over their bodies to where they want to depigment. It works extremely well, but you have to maintain that. So because some vitiligo, it corrects itself, because it's an autoimmune disease, so it goes on waves kind of. So in order to maintain the depigmentation, they have to use hydroquinone basically forever. And they do. They use it at a high concentration, like we're talking like 20% hydroquinone, which can only be made in a specialized like hospital pharmacy. You can't buy that just anywhere. And then they use this, and they keeps their skin depigmented. So, and these patients use it for, we're talking like decades, and they're fine. They're fine, and it allows them to achieve that level of depigmentation they want. So, if you look at patients who've had that done, and then compared to someone who's using a 2% 3 times a week, I mean
4%, yeah.
Fine.
Or like me, I use 4% every day because it's in my Dramatica.
It's fine. It's fine to do that. It's totally safe. I think that a lot of the bad press for hydroquinone has come from some very bad some case reports have just been blown out of proportion. Oh, sorry. And also, the anti-pigment cream industry in the cosmetic skincare world is massive, okay? And it's a massive moneymaker. So
yeah, isn't Unilever like one of the biggest makers of anti-pigment creams? I think Unilever is.
Is that Eucerin? No, Eucerin is Beiersdorf. Yeah, I mean anti-pigment cream, like all these kojic acid creams and all this other nonsense. They don't do anything, but it's a huge market because everyone, and you have an entire part of the world, like the South Asian kind of continent, India and stuff, where these women want to have a culturally lighter skin. So you have a huge market for them. People do glutathione injections. They have crazy stuff. in order to lighten their skin. And so the market is massive. So you can buy tons of skin brightening. I mean, Clinique makes a skin brightening cream. You know, the one with they advertise it with the white egg with the spots on it. And then, do you remember those ads? They're really beautiful ads. Oh no, okay.
No, I try to avoid ads like the plague. I hate them.
Yeah, but they were such beautiful, because they're in magazines and stuff. They make these beautiful ads with these eggs, and they show how their cream removes the pigment. Yeah, so Eucerin and anti-pigment is quite expensive. So this is a massive market. So it would be in the best interest of these companies to make sure hydroquinone looks bad, because of all of these topicals, hydroquinone is the only one that actually does depigment. You know, it actually does the job. You know, oh, Emma remembers the one from Clinique. Yeah, beautiful advertisements. I will say, you know, some of the marketing is just fantastic. But anyway.
Oh yeah, that's the point.
I mean, honestly, like even I was like, wow, that's a beautiful ad. But
yeah, that's the point. That's why I don't like watching them, because it really irritates me.
Yeah, it's annoying. But yeah, even Vaseline makes, so all these companies make these.
Wait a second, Vaseline makes their own anti-pigment cream?
No, Vaseline the brand, because you know Vaseline the brand, you can also buy like Vaseline body lotion. It's a brand. It's not. Just
oh yeah. Their lotion sucks, man.
Yeah, no, so they make tons of moisturizers and stuff. But so that's I think part of the reason that hydroquinone is slagged off so much is because of that industry. And even within London, you have the hyperpigmentation clinic, which slags off hydroquinone on their website, and then they try to get you to buy these extremely expensive mandelic acid peels, which they sell instead of hydroquinone, which again doesn't really do the job, because melasma is, we should really consider it a chronic condition. You can clear it, and then you have to maintain it by vigilant sun protection, and almost certainly using some kind of a topical. Some people can get away with just tretinoin. Some people need a little bit of hydroquinone in there too. There's nothing wrong with that. It's totally safe to do and totally fine.
So I can use the hydroquinone in my tretinoin all my life?
Yeah, it's totally fine.
Because none of this is going away, which is really starting to bug me.
What isn't?
I have like a lot of sunspots from like all the tanning. I've got like all these that are not freckles.
They might not be freckles. They're probably seborrheic keratoses.
I don't know. They're just like big brown.
Are they flat, or are they?
They're flat, and they're just like a beige. They're like what I used to look like when I would actually tan.
But can you feel them?
No.
Oh no. You might need a stronger hydroquinone temporarily.
You can't really see it. Yeah.
Yeah. So,
oh well, but they don't do that in the States. We don't go above 4%, right?
You can from the compounding lab. Yeah.
Really?
Mhm.
I got to see if I can find that then.
Yeah, I got someone to. I don't. California might have its own rules, because every state is like a country. So I know in New York City, I'm almost certain you get over 4%. But again, the U.S. is odd with all this kind of stuff. I couldn't really tell you. But yeah,
I'll have to see what I can find out. Actually, you know what? I'll ask my GP to get me a dermatologist, and I'll just ask them, because it bugs me.
But yeah,
I don't.
But so anyway, so that hydroquinone thing, it's annoying for me, because it gets it's just like isotretinoin. So Chris asked to discuss iso and hydroquinone, and they're two of the most effective dermatological medicines we have, and they're also two of the most misunderstood treatments. And I always feel like partially anything that works really well gets a bad rep for some reason. I find that a lot, especially in skin. And it's because there's competing.
The user. Is it possible that the user is using the product incorrectly?
Yes. Yes. And that's also a bit of a problem. So there's, lots of issues. But I mean, I think if you're under good medical supervision and your doctor understands what they're doing with you, which I like to think I do, then it's totally safe and totally fine. Chris, it's made out to be very scary. I know. Both hydroquinone and isotretinoin are made out to be very scary, which it always kind of baffles me, because it's like, why is the stuff that's so good made to be scary? Like, come on, this is like life-changing for so many people. Hydroquinone can change people's lives, and so can isotretinoin. So it can be upsetting. Can I be using my 0.1% tretinoin hydroquinone every night? Yeah, that's fine. If you're using it every night and you're not getting dryness, then even if you were getting dryness, you can still use it every night. But yeah.
Yeah, if you're kind of like what she told me, Ludke, or whatever your name there is, put a sheer thing of Vaseline on top, and that goes away. Trust me. I mean, it doesn't go away, but it helps mitigate it.
Helps reduce. Yeah, exactly. Mitigate's a good word. So yeah,
really
cool. So we'll have to do more of that talk next. If we can do this again next week, which hopefully we can.
Yeah. Let's see if we can do next week and maybe finish covering this because like one of the things, yeah, he wants to know all about the bad press. Chris does on the isotretinoin, and I know that a lot. Oh, we got 20 seconds, and I know that they talk about like cancer and all this kind of caca stuff. So anyway, guys, we're gonna go ahead and find out when her and I can talk again, and then we will set it up, and you can post your questions below. And we love you, and we've got 9
Love you
seconds.
too.
And
Thanks, Kat. Lucy, no, you won't. Lucy, no, you won't. But we can talk about that at some point. All right. Thank you, Kat. Good night.